Hello and welcome to our viewers and panelists. My name is Dr. Stephanie Trainer, and I am the Deputy Director of the Division of Prevention and Behavioral Health Services. As we emerge from the COVID pandemic, we want to share information and resources around behavioral health and how these resources can assist you and your school communities. We have all felt COVID's impact on our mental well-being in one way or another. And weathering this difficult time takes collaboration, resources, and most importantly, conversations. We have an opportunity together to build greater resilience among our students. This webinar is designed to empower education administrators to nurture the emotional well-being of their school communities. Throughout this presentation, you will hear from experts in the behavioral health field from the Mental Health Association in Delaware, NAMI Delaware, Nemours Children's Health, the American Foundation for Suicide Prevention, and Delaware Guidance Services. They will share information about how to support youth, caregivers, and educators and their mental health, as well as sharing resources that can help your school community navigate a crisis and work to prevent the occurrence of a crisis in the first place. These organizations are available to collaborate with you, share information, and educate stakeholders and the public on behavioral health resources. Briefly, I want to share the topics that we are going to cover today. We will look at resources in prevention and intervention, specifically about suicide prevention and crisis, and opportunities for continuing education and engagement. We organized this information in small bites so it will be easy to digest. We know the topic of behavioral health is expansive, so we are all here for additional questions and resources. First, we will start with prevention. So what do we mean when we talk about prevention? Prevention is about engaging youth and families before a problem arises. Prevention programs promote health and wellness. They teach valuable skills and create opportunities for positive engagement and experiences that are designed to prevent youth from engaging in risky behaviors. Often these programs target specific behaviors or conditions, such as substance use, bullying, domestic or community violence, and suicide. Research shows that prevention programming can help adults and children thrive and lead healthy lives. In a school setting, you can take an active role in promoting an environment that is compassionate, trauma-informed, and focused on emotional well-being and resilience. Just as important as action in crisis situations is creating an environment with resources to reduce the risk of a crisis occurring. Also important is laying the foundation for a crisis response by planning ahead and ensuring a quick and effective response. A key element to prevention is communication and information sharing. We are with you today to make ourselves available and share resources in your communities so you can feel confident, aware, and connected around the topic of behavioral health. I'm now going to turn to Sue Mulhern from NAMI Delaware to speak about prevention more in depth.
Welcome. I am Sue Mulhern, and I am the Assistant Director of Advocacy and Education at NAMI Delaware. Thank you, Dr. Trainer. As you mentioned, the Division of Prevention and Behavioral Health Services funds prevention programs in our communities statewide, and we leverage state and federal funds for that. The programs are available in community organizations, early learning centers, as well as schools. And the division also coordinates with police and athletic organizations. Really want to highlight that these programs are free for all youth and families, although some have eligibility requirements that relate to the source of the funding. One example is last year, the after-school and summer programs, providers added evidence-based suicide and violence prevention programming. That program served well over 2,800 youth across Delaware. Other programs have been expanded to include offerings for youth substance misuse. And these programs are designed to reach out to youth and families where they are in that process. Another example is a provider is working to deliver an array of substance misuse programming to 13-year-old boys that are involved in their football program. This program also offers a preventative program for the caregivers of those youth. And really exciting, 93% of the parents and guardians for the youth participating in that program completed the caregiver program. And if you want more information on that, you can access the prevention helpline that's listed on this screen, as well as the email, and it'll also be provided at the end. So we wanted to let you know across all of our organizations, there are many programs that support school administrators, faculty, and staff. Schools can partner with organizations like NAMI Delaware to coordinate programs of presenting to your staff, your faculty, and or your youth. An example of one of NAMI's signature programs is called Ending the Silence, and it's focused on youth, and it breaks down the stigma of mental health conditions, and it fosters open and candid conversations. We also have custom programming out there available for our LGBTQ youth. We have Spanish-speaking specialists, and we're happy to customize the programming. We recognize that all youth are vulnerable. Some are more vulnerable than others, and mental health challenges, whether diagnosed or not, can go hand in hand with other health and behavioral risks that include substance misuse, experiencing violence, and other high-risk behaviors. We want to make sure that healthy behaviors and habits are established in adolescence because those behaviors will follow through into adulthood. We also want to talk to you about what you can do to support your youth. In particular, breaking down barriers and connecting with your students in the classroom, whether virtually or in person, is a big help. Helping students feel connected to the school, their family, that can help prevent a range of negative experiences. And by building strong bonds and relationships with trusted adults, people in the school community, at home, that sense of connectedness will help eliminate or minimize the feelings of isolation that some adolescents can feel. Ultimately, our youth just need to know somebody cares. And sometimes showing they care is linking them to preventative mental health programs, integrating social and emotional learning, training staff and supporting staff about mental health, and building safe environments. A few other programs that many of us offer, including NAMI, are wellness and support groups to get ahead of the game. And these are available to adults as well as school leaders. And the benefits are that we will have conversations that take place about what's going on so that we can collaborate and learn more from each other. Also want to mention that Mental Health Association, the American Foundation for Suicide Prevention have programs, and the AFSP can provide schools with resources that caregivers can get to learn more about mental health, signs of risk, and the other stigmas that are involved. Knowledge is really empowering. Finally, I'd just like to state that we recognize there's a significant amount of burnout in the community, especially with our educators. Burnout is different than stress. It takes it to another level. And NAMI does offer a program called Feeding Your Flame that talks a lot more about the importance of how we need to care for ourselves. The whole put your oxygen mask first on is really important for all of us. And some of the things we can do is recognize staff contributions and achievements. Make sure we're celebrating milestones, not just talking about the negative things. Let's find some ways to share stress management opportunities and how we can diffuse some of these situations, and build physical activity breaks if we can at all possible. Ultimately, when it comes to prevention, building strong bonds and connecting with our youth can protect their mental health and hopefully prevent some serious mental health crises. We really want to reiterate that knowing what resources are available really empowers staff and reduces the stress. So I'm going to tag this over to Dr. Camarada from Nemours for more on early intervention.
Hi, everyone. I'm Chrissy Camarada. I'm the clinical director for our clinical child and community program here at Nemours. And in the mental health continuum, the next step is early intervention. And that could mean anything from intervening at an early age or at an early phase of a crisis or a presenting concern. We know that these services really have the best success at helping a kid or family get back on track. And so early intervention is one of the most important pieces of what we do. What we want to do is bring services to the most natural location. I think that's where you're really going to have the best chance of success, is if you can intervene where a youth or family is very comfortable. And so we have a number of different options for those services here in Delaware. You may be familiar with some of DPBHS services offered within your schools. DPBHS works collaboratively with education officials to intervene early to help children who are struggling. These services are provided for children experiencing social, emotional, and behavioral challenges in early learning, elementary and middle schools. So just some data about exactly how much this is utilized in our schools. In 2021, the early childhood mental health consultants, as part of these programs, served 120 early care and education programs and provided 188 child-specific consultations, 168 classroom consultations, benefiting about 3,900 children. And they also delivered 143 trainings to about 800 early learning professionals. The elementary school program served 855 youth and their families and provided about 11,700 interventions. Finally, the middle school program, or the behavioral health consultant program, worked with 419 students and families, providing an array of services, including 6,068 counseling contacts. Nemours also offers a number of different early intervention programs. The first being our integrated behavioral health primary care program, which involves embedding mental health providers into the primary care setting. So we're essentially treating mental health, social, and behavioral health concerns the same as we would any medical condition. We're screening, we're intervening, and we're talking with families in a location that feels very natural, as if it's part of any kind of other typical medical care. We also offer a similar type of program for our integrated specialty care, which is working with kids who are followed by medical clinics for chronic medical conditions or other acute medical conditions. We also have a partnership with Child Development Watch. We offer a behavioral health consultation clinic for kids under 5, which really serves a full spectrum of concerns that any child under 5 years old might come up with. So that includes sleep, toileting, behavioral and conduct concerns. And we know that when we can, again, implement these interventions with families at this young age, that this can really help kids avoid some other concerns that can be associated with having these early difficulties. And finally, we have our behavioral and developmental access clinic, which is a partnership with our developmental medicine pediatricians and psychology to assess kids at an early age and identify any developmental or behavioral concerns. So in thinking about how schools can be a champion and really work to partner with our behavioral health services, either through DPBHS, Nemours, or other organizations, I think really normalizing and encouraging schools and school staff to promote self-care, to take part in and participate in these different interventions, so that we're sending the message that this is really a part of everything that we do for youth and families, and it's no different than any other care that we might provide in a medical setting. Finally, we have some various helplines here, which are resources for families. So school educators should be aware of these. You can connect families with them. You can also use these for your own support as needed. The Trevor Project, which is the last one here, is one of is a program that's designed specifically for LGBTQ youth, and the rest offer free 24/7 counseling for kids and families who need support.